Hey guys, Dr. Ina and Dr. Maha is here. Welcome to our channel. As you remember, we talk about medicine, alternative medicine, the hybrid system, the holistic approach to health and beauty. So today's episode will be about emotional release technique. We'll show you a very simple way how to get the emotions out of your body, and hopefully you'll use it, and we are waiting for the comments back from you. So you know that emotions are stored in your body, okay? And emotions can be stored since the day we're born, and we can carry it because remember, cells don't lie and they never forget anything. So there are simple ways how to release it and how to make everything easier on the body. And that's the topic of our episode.
So I have a question for you, Dr.
Yes.
Ina, since you're the chiropractic here. I have heard and seen a lot of talk about the role of adjustments in actually releasing motion stuck in the body, and I would like to see how does that work?
Okay, so as you know, spine is not only to move the body. So spine is our energetical pillar, okay? It carries our sympathetic and parasympathetic nervous system. It carries the nerves that innervate all of your organs, right? We have central nervous system, which is our brain, but then the spine is our peripheral nervous system. And we need to have a balance between the central nervous and the peripheral nervous system. Since the spine is the backbone to our organs, so what happens if, let's say, we carry tension in our spine, right? It can mimic even the heart attack, or a person can start coughing, or like we have something that's stuck in our throat, right?
I didn't know that.
So all of these emotions, and a lot of people are like running to the doctors or running to do diagnostics because they think that something is not right with their internal organs, but it can happen just because the spine is out of alignment. So I know you asked me about the emotions, but I really want to emphasize that going to the chiropractor is an important thing to do.
I believe
You know,
that.
because if your spine is properly aligned, it's properly stretched, and all of the vertebrae are in place, your organs and your emotional state being will be in such a better place. So a lot of the times when people are going through some emotional distress, adjusting the mid-back, which is the thoracic spine, will actually release some of the stuck emotions that are maybe in your lungs or in your heart or in your abdominal region.
Wow.
Yes. So it's not like come to me. You just need to pick a proper chiropractor.
But come to her.
Proper chiropractic physician, and go and explore the alternative way of taking care of your body.
Okay. So I can add like a little bit because I've delved into holistic medicine, and one of the things that they taught us is that certain areas in the back, the pain there relates to certain emotions. So one of the ones that I remember with the lower back pain relates to financial instability.
Okay.
People who are worried about their finances end up having lower back pain.
No wonder I have so many patients with lower back pain
lower back
nowadays.
pain, yeah. But that proves the point that the pain that we feel in the back can like related to emotions, and each area of course has its own thing. The other thing is that I think what ties in nicely with the emotion, there is this field called myofascial release, and it's based on the idea that our emotions, when we're not processing them, which is the case of humanity today, they actually get stuck in our muscles and fascia. They literally get crystallized there and get stuck. And that stuckness in there causes the muscle to spasm. and then the muscle spasming will, year after year, is pulling on those poor vertebra. The vertebrae are being pulled all the time, so they end up kind of, the vertebra, right, move from its place.
And in chiropractic world, we call it subluxation, spinal subluxation.
That's the one.
So it's not really a subluxation where it can be even noticed in the MRI or X-ray. Yes, there is a subluxation in the medical world as well.
Pronounced.
But in a chiropractic, we call it chiropractic vertebral subluxation, where the vertebra moves maybe micro distance, but it still creates that disbalance, disharmony that will affect your internal organs or your emotional state being.
True.
Yes.
And the thing is that when the subluxation, the micro subluxation, is causing the nerves in the area to kind of like, oh, something is wrong, right? And the nerves go to the brain telling that something is wrong. The brain cannot tell the difference.
Correct.
If the irritation of the nerve is coming from the end, like the liver or the heart,
yes,
or from the way.
Correct.
So that's why, as you said, people go to doctors thinking something is wrong.
Because a lot of the times it's like, no, before they come to me and it's like, no, I really want to go to my primary care so they can check my heart or they can check my digestive system. And I never say, no, don't go to your primary care. But there are times where I can, detect it that it's not really coming from the internal organs, that it is coming from the spine. The spinal subluxation can mimic that type of pain.
Yeah.
So guys, never ignore chiropractic, never ignore your spine, even though it doesn't if you don't experience sciatica, you still should check with the chiropractic physician and make sure that you're free of spinal subluxations.
And can you tell us a little bit about the craniosacral synchronization?
Sure. Sacrum, which is the lower part of your spine, and your head, which is the cranium, has a very, very similar anatomical correspondence, and structurally they're very similar.
Okay.
And since cranium and sacrum, in medicine, they're not moving parts, but it's the beginning and the end.
Yeah.
So the proper alignment of those two structures can actually realign the full spine without pushing on the spine, because some people are really skeptical on the cracking sound, or they say some chiropractors are too forceful and they're not really fan of it. So by proper aligning of the sacrum and the cranial work can actually realign the full spine.
I heard there's a wave for this, the CSF, which is the cerebrospinal fluid.
Correct.
That it goes through it?
Yes.
Do you feel it?
You don't feel the fluid actually circulating, but when there is no blockages in the spinal column where the cerebral spinal fluid is circulating, flowing like in a proper flow, then you feel very light. Your posture is improved, your mood is better, you kind of like show more confidence when you walk, when you talk to people. So the proper alignment is making huge impact on your lifestyle.
You do that. So if I come lie down, you can tell me like if the flow is right or wrong.
Yes.
Can you tell? Oh,
yes.
wow.
I can tell it by doing my chiropractic exam and also the kinesiology. It's the muscle testing that I can see where there is a disbalance takes place.
Okay, so what is muscle testing?
Muscle testing is the diagnostic tool, one of the diagnostic tool, which is not really accepted by mainstream medicine.
Yeah, but we're doing alternative medicine here, so we can talk about everything.
So as I said before, your cells never lie and remember everything. So when you instruct the patient to, let's say, hold your arm, and we start talking to your body through pushing on the arm or the leg, then the body will tell you if it agrees with you or disagrees. So we will show you later on the practice, so this way it's going to be more understandable what exactly muscle testing is. But it's a great tool in alternative medicine to actually see if you're resonating with a certain either therapy or supplement or any other lifestyle, maybe modification that you're trying to do.
So yeah, I did muscle testing too, so I'm familiar with it. And the principle is the body has its intelligence, and if you put some material that is beneficial to it, because we are made of energetic fields, and these energetic fields interact, and if the substance is beneficial to you, it will strengthen the body. And that will be translated in the micro movements. That's the whole principle of the muscle testing. It relies on micro movement. So if the substance, the energetic field of it is detrimental, there'll be this micro weakening of the body, and it will show
quit.
itself, right? Yeah, by the muscle, by the arm not being able to hold itself against pressure.
Correct.
While if it's synergistic and strengthening, that will manifest in a micro movement of strength that will make the arm hold
Strong.
itself. And I think, Dr. Ina, because you're so proficient with it, at some point would be nice to show them.
Yes,
like
I would love to do
how,
that.
How to, what it looks like. How do you ask it? What does it feel like? Because when it's done to me, I mean, there's no pain, there's nothing. It's actually very interesting to see. Clearly, you put white sugar and then the arm goes like that. Like, I think everyone
Or
knows
not.
that. Or not.
Or not. Or sometimes,
Really? Yeah?
yes,
Oh, wow.
and sometimes people are, let's say, sensitive to sugar or not. So it doesn't mean that the white sugar will be weak for everybody.
Everyone, okay.
But majority of people, yes, they will show you weakness on white sugar.
Yeah. So
Comparing,
I learned
for
something
instance,
every day.
For instance, if you using the raw sugar,
Yeah.
which is much better
Raw-
than the white sugar.
Yeah, raw sugar. I use that.
But we'll show you.
Okay.
We'll show our clients how to do the muscle testing and how it actually works.
Yeah. So let's
ready
talk
to-
about emotional release.
Yes.
So going back to what we talked about earlier, which is emotions that are not processed. Life is hard, and or not even. Sometimes you go through a phase and you go through emotional upheaval, fear or worry or grief.
Yeah, there is so many
things,
sadness,
and you
jealousy,
all of it, and
all
you
of
just
it.
learn to say, okay, I need to go on with my life. I'm just gonna block it. So the emotions don't disappear, right? If you block it, it's stuck there, and it's gonna stay there until you do something about it. And we are very lucky to live at this day and age. There's so many modalities coming out that help us, sometimes with a practitioner, sometimes alone, to be able to move that baggage and release it from the body. And by doing that, not only are you restoring your emotional well-being, you're actually restoring your physical body's well-being, because it's like, imagine the poor body carrying all that weight, and like cannot move, cannot thrive because all that weight that is being held there. So one of the methods that I just discovered, and I really fell in love with it, it's called Dr. David Berceli, and the technique is called trauma release exercises. And I can't think of anything simpler or more effective than this method.
And I actually tried it a couple days ago, thanks to Dr. Maya, and the results were incredible. That's the reason why we're actually doing this episode, because I really would like everyone who is interested in that type of therapy to know, because you don't need to go to any practitioners, you don't need anybody next to you to do it, and it's done in a very short period of time, so you don't need to dedicate half of the day to actually do it.
True.
And you can do it as many times as you like, because there are no negative side effects from that.
That's true. So Dr. David Berceli has some YouTube videos where he teaches it online. And we're just doing it for educational purposes, to share this and encourage people to seek out the certified practitioners from his institution. I think it's called Trauma Release Exercise Global. So you can reach out to them if you felt like you needed to expand beyond the basic. But I'm happy to show the basics, which I've learned, because I think everyone should incorporate that in their daily routine. You know, like you brush your teeth and then you lie down and you do your trauma release exercises.
Okay, so if you're ready, we can.
Yeah, let's do it.
Yep.
Okay, so Dr. Ina, if you can put your feet together like they're kissing each other. Yeah, okay. And yeah, this distance a little bit closer, Yeah, okay. So now the aim is to fatigue the muscles but not hurt them. So if you can lift up your pelvis as high as you can, but making sure you're not in pain, right? And you're comfortable, and don't use your hands or arms to push, right?
Right.
Use
they are free.
only your back and the hips. We're gonna hold that for 1 minute until the body is fatigued. So I'm gonna time it. It's good to be patient and not rush, and dedicate like 15 minutes to do this. You know, so have a timer or a phone next to you to time. If you're an athlete or really like strong muscles, you might need to stay 2-3 minutes, or even up to 5 minutes if you're really that like a bodybuilder. Because as I said, we want to fatigue the muscles. So like 30 seconds more, and you can see the hips are kind of swaying. Maybe it will not show on the video, but the hips are swaying, which is a sign that the muscles are being fatigued. So why do we want to fatigue the muscles? Okay, you can rest for a minute. The reason why we want to fatigue the muscles is the body gets used to holding all that emotions inside and has a compensation mechanism of tension, and it's been doing it for a long time. So what we're trying to do with the fatiguing of the muscles is that we want to break that mold. So now you're relaxed, right, for about a minute. So now you can raise your knees a little bit, 1 inch, just 1 inch, and wait for a minute. So what are we waiting for? We're waiting for shaking to start. That's usually what we see. If you can, I don't know if on the video you can see, there's trembling that is starting. And that's what we want. The trembling is the body speaking. The trembling is the body releasing the tension it's holding. So Dr. Ina here has done it, so she already knows the angle, right? Now that the shaking started regularly, you can put your feet flat on the, yes, exactly. And you can adjust the angle between them to facilitate the shaking. Wonderful, now she's shaking. Wonderful, see the shaking? This is the body releasing. Now the shaking is gonna move the legs, the feet, the hips. It will go up the spine, the shoulders. So you just relax and enjoy the ride. You don't need to force it. You don't need to control it. Don't freak out. It's really, this is good. This is the tension. The body is releasing it.
And from my previous experience, the maximum time that I've done that type of technique was like 15-20 minutes, and it can start slow in terms of like shaking just my lower body, but then it can move up, and you can start feeling your shoulders moving, your spine. And right now it's done involuntarily, so I'm not just doing it for the video purpose. It actually, my body is shaking because it wants to shake with this particular speed and this particular movements without me initiating it. So that's pretty much where the beauty of this little technique, I wouldn't say little, of this technique, because you shake your hardship off your body.
I like that. Yeah.
Yep, you're shaking off, and that's pretty much, you don't need to be professional in it. It just comes automatically. I think it's kind of like a hidden technique that our body is able to shake.
Exactly. Yeah, the body knows.
And we don't appreciate it.
Right?
We like, no one is teaching us how to shake it off.
Yeah, the body knows. I mean, Dr. Berceli, he took it from a neurologist, a biologist who showed how animals in the wild, after a stressful event, they shake. And he hypothesized that, well, humans should be able, we should have it in our bodies. And that's how he just learned to reveal it. The body knows what to do if we get out of the way. And this is what we're doing. So Dr. Ina's not moving herself. Her body is doing it by itself. And it's releasing stuck emotions in her field, realigning, right, your body, your bones, freeing the fascia from all that baggage. See how it went up to her shoulders now? It's wonderful. And if you can just enjoy the ride, like try to do it. I'm doing it 2-3 times a day. Dr. Ina, how many times do you do it?
I try to do it in the morning for sure. And little tip for you guys, I tried it on my bed and it's not really giving me the same effect as you do it on the floor. So make sure that you try it on the floor, not your bed. And so I do it twice a day, once before my active day starts and before I go to bed.
Yeah, I think that's wonderful.
And it's usually like, as I said, 10-15 minutes, maximum 20 minutes. And then, I don't have to go through some sort of like either meditation or breathing, which is great as well. But as we're filming, my body is doing this involuntarily without me going into some kind of practice.
And then once you're done, when you're done and you feel like, okay, I'm done, I don't want to do anymore, right? You just flatten, like put your legs down, relax for 1 minute, no movement.
I actually don't want to. But
right, yeah, one move. Well, just 1 minute. Yeah, she's still moving. But hopefully you stopped moving, and then 1 minute, just letting your body integrate, and then move. Don't just like from the height of it, just take off, because you're gonna interrupt the integration process.
So the whole point of us sharing that, as you know, that the mental illness is on the rise with anxiety, depression, obsessive compulsive disorders, addictions, and they're not coming over just one day. The emotions and the stored pain is accumulating in years. So anybody who is experiencing this should try it. It doesn't cost anything. And you shouldn't get off your medication, or you shouldn't get off the treatments that the doctor prescribes. But you get to the point where you have to be an expert of your own body and feel the body and experience the movements. It's like a beauty of dance, why people love to dance, because they're expressing themselves through the body movement. So that's a little technique. We'll show you how to get the hardship of your body in a physical and energetical form.
Yeah, do it.
Yeah.
Do it.